So your practitioner just handed you a prescription for Paxil, and now you're probably asking, what exactly is this stuff? Is it actually going to help? And what's the catch? Side effects, withdrawal, long-term risks? Totally normal questions. Starting any psychiatric medication can feel like a leap, and you deserve real answers, not just a pharmacy printout. Paxil, also known as Paroxetine, is one of the oldest SSRIs out there. It's been used for decades to treat depression, anxiety, panic attacks, and more. But here's the honest truth. Paxil is almost never my first choice. Yes, it can work incredibly well for some people, but it also comes with trade-offs that I think every patient deserves to know about. I'm Dr. David Danish, a double board certified psychiatrist specializing in child, adolescent, and adult psychiatry, and I've treated tens of thousands of patients across all ages and diagnoses. And I want to walk you through what Paxil really does, who it helps, and what to watch for. Paxil is part of a medication class called SSRIs, selective serotonin reuptake inhibitors. That just means it helps your brain hold on to more serotonin, a chemical that plays a major role in mood, anxiety, and stress regulation. Paxil is FDA approved for several conditions: major depressive disorder, generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive compulsive personality disorder, post-traumatic stress disorder, also known as PTSD, and premenstrual dysphoric disorder, known as PMDD. And off-label, it's also used for hot flashes during menopause, certain chronic headache syndromes, and other anxiety disorders not mentioned. If Paxil is going to help you, here's what to expect. Most people don't feel much in the first few days, or even in the first 10 days. But by week 2 or 3, you might notice early changes. Less panic, less edge, a little bit more motivation. The full effect, though, kicks in over the next 6 to 8 weeks from the start date. Some signs it's starting to help. You feel emotionally stable, more relaxed. You might sleep a little better. Your thoughts may start to feel less noisy, less obsessive, less overwhelming. Now, let's look at side effects a little bit. The 3 side effects I tend to see the most often in my patients usually show up early, but can often fade within the first couple weeks. Stomach upset of various ways is very common. I often recommend taking it with food, and we usually start at the lowest dose and go up slowly. Some patients complain of dry mouth, and some may complain of mild drowsiness as well. Some side effects that might stick around longer, and this is where Paxil does get a little bit tricky, especially compared to other medications in its class. Sexual side effects are fairly common. Things like lower libido, delayed orgasm can affect up to 30% of patients. Weight gain is also a little bit more likely on Paxil than other SSRIs. It's not at all guaranteed, but it does happen at times, and I do track it closely. Now, the rare but serious side effects everyone needs to know about. Any antidepressant has a black box warning for patients under the age of 25. There is a 1 in 132 risk or less for someone to have worsening depression or increased suicidal thinking when they start an antidepressant. That is true for Paxil. Of course, that means stop it, go to the ER, tell your provider. Now, if Paxil is combined with other serotonergic medications or supplements, something called serotonin syndrome can occur. It's extremely rare. I've never seen it myself in thousands of patients, but it can happen. So I'm gonna send you a link to a YouTube video that discusses that in detail, as well as a MindVault written resource that discusses that. Paxil also has a bit of a discontinuation syndrome. If you missed even one dose, you're gonna notice it. You're gonna feel a little dizzy, irritable, or get something called brain zaps that just are very distracting. I never would stop Paxil abruptly. If you've been on it for a while, it's something you should come off slowly for that same reason. Here's my take after prescribing this for over a decade. I almost never use Paxil as a first line or even second line antidepressant. Why? It tends to have more side effects. It's harder to come off of, and it does interact with other medications more often than, say, Lexapro, Zoloft, Prozac. But that definitely does not mean it has no place. I often reach for Paxil when a patient has had success on it before or a close family member has. I've encountered many patients in whom either themselves or their family member only did well on Paxil even though they had tried Lexapro, Zoloft, and Prozac. Paxil has the highest serotonergic activity of any SSRI, which means it may hit in better ways for some patients, even though that also means it may have more side effects. Just know this, Paxil is a tool, not a magic switch. It takes time to work. And trust me on this, do not stop Paxil cold turkey. Make sure you taper off, and that is doable without major side effects. If this helped at all, please subscribe to my channel, share it with others, and please don't forget to visit the Mind Vault at Dr. David Danish. It's full of tons of free tools, whether you're trying to look at the side effects of various medications, or if you're looking for tools to help hone in on a diagnosis that feels right for you or a loved one. I'm expert in treating ADHD, depression, anxiety, bipolar disorder, autism, psychotic disorders. I have resources for all of those there. One of the most important resources in the Mind Vault if you're starting an antidepressant is how to supercharge your antidepressant. It's full of science-backed tips to help your medication work better and faster.